Yuma in the state of Arizona has 4,000 hours of sunshine per year, making it the sunniest place on the planet. That is our tip for the day. Now let's go to weather. According to Oman Meteorology and Civil Aviation Authorities, the weather will be cool with mainly clear skies over the rest of the Sultanate and chances of low-level clouds in parts of Al-Wusta. And the wind will be northerly to northeasterly, light to moderate. With that, let's take a look at how the weather will be like in all the governorates. Muscat will be sunny, temperatures between 22 to 14 degrees Celsius. Musandam will be sunny, temperatures between 20 to 15 degrees Celsius. North Al-Batana will be sunny, temperatures between 23 to 13 degrees Celsius. South Al-Batana will be sunny, temperatures between 21 to 12 degrees Celsius. Al-Buraymi will be sunny, temperatures between 24 to 12 degrees Celsius. Al-Dhahira will be partly cloudy, temperatures between 23 to 11 degrees Celsius. Al-Dakhiliya will be sunny, temperatures between 23 to 12 degrees Celsius. North Al-Sharqiyya will be sunny, temperatures between 25 to 11 degrees Celsius. South Al-Sharqiyya will be partly cloudy, temperatures between 22 to 16 degrees Celsius. Al-Wusta will be partly cloudy, temperatures between 24 to 14 degrees Celsius. And Dhafar will also be partly cloudy, temperatures between 20 to 11 degrees Celsius.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Hello and welcome to Outline. Today we are commemorating the first anniversary of His Majesty Sultan Haitham bin Tariq on his accession day. May God protect him. Now let's take a look at what happened on this exact day last year.
His Majesty Haitham bin Tariq was sworn in as the new Sultan of Oman on Saturday, January 11th, 2020.
فإننا بعد التوكل على الله ورغبة منا في ضمان استقرار البلاد نشير بأن يتولى الحكم السيد هيثم بن طارق، وذلك لما توسمنا فيه من صفات وقدرات تؤهله لحمل هذه الأمانة.
His Majesty Sultan Haitham bin Tariq, in his coronation speech, paid tribute to all that Sultan Qaboos bin Said bin Taimur had accomplished, assuring the citizens, residents and world leaders. His Majesty Sultan Haitham bin Tariq promised to continue the Sultanate's policy of strategic neutrality and work for regional peace and security and the prosperity of the nation.
Oman will make big strides towards progress under the leadership of His Majesty Sultan Haitham bin Tariq, say Omanis in the country. 11th of January marks the first anniversary of His Majesty being sworn in as the Sultan of Oman. And in that time, he has done so much to improve the country's economic and social structure for the long term. Yunus bin Ali al-Mandari, the head of the Youth and Human Resources Committee at Majlis al-Shura, was impressed by His Majesty's ability to steer Oman through the troubled waters of COVID-19 pandemic and the economic impact it had in the country. His Majesty assumed power under difficult circumstances, he admitted. The coronavirus pandemic aside, he also had to deal with low oil prices and the issues around job seekers. He immediately formed the Supreme Committee for dealing with COVID-19 so that he could follow up on the developments of the pandemic and work to limit the spread of the virus. The committee was also formed to protect citizens and residents, to provide support to all economic sectors of the Sultanate that were affected by the COVID pandemic, added al-Mandari. He personally chaired the committee several times so that he could take informed decisions and safeguard the health of people here. One of the cornerstones of His Majesty Sultan Haitham bin Tariq's long-term plan for Oman is Vision 2040, which aims to successfully diversify the country's economy and provide good standards of employment and living for all. With this in mind, His Majesty has drafted many new law and reorganize some of the state's apparatus so that it is more effective towards achieving these objectives. He prepared for the Vision 2040 through various royal decrees and ministerial decisions, as well as by merging government bodies, ending some others, and creating some as well, and to provide an agile and effective government with defined goals and results to serve the country. Encouraging Omanis to work hard and make conditions better for foreign investments were two of His Majesty's key achievements, said Jassim al-Balushi, the Deputy Head of Education and Training at the National University of Science and Technology's College of Engineering. We have been working very hard to build Oman, he said. We must celebrate the achievements we have accomplished since the dawn of the modern Renaissance and show some love for our country and our Sultan, His Majesty Haitham bin Tariq, as well as remember the legacy of his late His Majesty Sultan Qaboos bin Said bin Taimur. All of us now know we need to develop our economy by diversifying our sources of income. We shouldn't depend on importing our goods, but produce them ourselves. We should now move to manufacturing and export models of business. Oman, for example, has a very long coastline, so fisheries could be an area that it is developed. Omanis have to become entrepreneurs, ready to create business and provide jobs for the next generation. Sulaiman Al-Sulaimi, an executive committee member of Oman Road Safety Association, was very confident that the country would continue to progress under His Majesty Sultan Haitham bin Tariq, and he called on all to help contribute in this direction. We are confident that under His Majesty's leadership, Oman will continue to progress and prosper, and sustainably contribute to the local and international development and understanding. We have a strong faith in his wisdom and wish him every success for years to come. Oman Road Safety Association would like to congratulate His Majesty on his first anniversary as the Sultan of Oman.
Under the royal directive of His Majesty Sultan Qaboos bin Said bin Taimur, may his soul rest in peace, a master economic plan was designed and planned for the Sultanate of Oman, along with the participation of Oman's leading representatives from all the segments of society, which included different entities, private sector, civil society organizations, and individuals from all the governorates. The plan is already underway, under the leadership of His Majesty Sultan Haitham bin Tariq, may God protect him, who is personally leading it as head of Oman 2040 Main Committee. Oman Vision 2040 is a plan for economic diversification, which aims to move Oman from oil and gas-based sources of income and has earmarked for development in many sectors that have high growth potential and economic returns, such as mining, energy, transport, logistics, tourism, manufacturing, agriculture, and fisheries. The Oman Vision 2040 is grounded on pillars, which represent the genuine Omani values and wishes, and these pillars are distributed in four main categories: people and society, enhancing family and community health and well-being; social welfare, equitable access to health and well-being; supporting women, the youth, and the people with special needs; empowering civil society organizations; upholding the Omani identity and heritage, the basis for Omanis to deal with globalization; developing the national technical and entrepreneurial capabilities; empowering citizens by equipping them with a high degree of scientific, technological, and practical capabilities; economy and development, creating wealth through economic diversification and private sector partnership; ensuring balanced governance development; preserving environment sustainability; building a world-class infrastructure and livable cities. Governance, improving the efficiency of government agencies and increasing coordination among them. enhancing citizens' confidence by creating an institutional framework that enacts laws and practices. Environmental and natural resources. Ecological systems that are effective, balanced, and flexible to protect the environment and sustain its natural resources in support of the national economy. A state with responsible apparatus, adopting comprehensive governance, effective oversight, swift judiciary, and effective performance.
Welcome back, and now with our COVID updates. The Ministry of Health has registered 0 deaths of COVID-19, taking the death toll to 1,580. The ministry has extended their deepest condolences to the family of the deceased. The Ministry of Health has also announced the registration of 172 new COVID-19 cases, taking the total cases in the Sultanate to 13,780. In the past 24 hours, there has been 157 recoveries, and the total number of recoveries now stand at 123,024. The ministry has urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health. To talk further more about fighting COVID, let's go to TTV Studio 2 with Antara Bose.
Welcome to Fighting COVID on Outline, a segment that's dedicated to all the latest updates on the coronavirus. On this show, we cover a variety of topics, like the challenges different economies are facing with regard to the pandemic, the new vaccines that are getting approved, the new strains that are emerging, and also what's happening on the local front. And talking about what's happening on the local front, we have with us a very special guest on the show today. We have with us Dr. Zayed Khalifa Suleiman Al-Mayahi, who is the Director of Disease Surveillance and Control in South Al Batana. Dr. Zayed, welcome to the show. Dr. Zayed, can you hear me?
Yes, I am hearing you. Good afternoon.
Good afternoon and welcome to the show. Thank you so much for joining us today.
It's our pleasure. Thank you very much. Thank you.
Dr. Zayed, you obviously occupy a very important position, especially when it comes to South Al Batana. How long have you been with the department?
Thank you very much first for shedding the light on an important disease, the COVID-19 pandemic. And for this question, I've been in this post for around 4 years now, after I completed my degree in Saudi Arabia as field epidemiologist. So it has been 4 years of challenges with communicable diseases, different diseases indeed. But the last one was the most, let's say, the most challenging and most difficult one, because it has been a new challenge not only for Oman but elsewhere in the world.
I agree, but you're doing a commendable job, Doctor. Doctor, so there have been news of a lot of new strains that are emerging. So I wanted to ask you, in terms of transmission, how are these variants different from the ones that we already know about?
It's the nature of the viruses, indeed, that they keep on changing. So this is not something specific for the COVID-19, but this is a fact which has been reported and seen in other viruses as well. So it wasn't something unexpected that we see the variants of the COVID-19, and this fact was actually noticed by the beginning of the COVID-19 itself, when different variants emerged in the China. But the latest variant, which has been seen for the first time on September, and then dramatically it had increased in terms of many infections within the United Kingdom, it indeed attracted the scientists and the specialists to look in depth for those variants. And as you know, that the COVID-19 virus itself is composed of a genome, the RNA genome, and on the outside of this virus there are some spike proteins. So through these spikes, this virus can actually go into the human cells and invade them. So what has happened simply is that the structure, the amino acids of the RNA itself, few mutations happened there, and because of those mutations, it has affected the output protein, which is the spike protein, which I have just spoken about, which is located outside on the COVID-19 virus. So the variant which appeared in UK is actually, it seems like it is on rise because many cases were reported in the United Kingdom, and it is believed also that this variant has gone outside the United Kingdom, and it is a fact that some other countries had reported this variant as well. Slightly different, there are some other variants similar to this variant of United Kingdom, but again, there are some other, or there are a few different entities of the genome itself. So it's actually quite early to say what is going about this variant, or that we conclude that this virus or this variant is more transmissible, for instance, in comparison to the original COVID-19. Yet, because of the fast transmission, perhaps in United Kingdom and others, and because that these variants are still under investigated and many aspects of the variant are still obscure, then it is actually important that people deal with this variant carefully, especially that all the preventive measures, they should be in place continuously.
Thank you for elaborating on that, Doctor. So again, talking about the new variants, do you think there's any difference in symptoms and management when it comes to these new variants?
Right. What has been reported so far is that there is no remarkable difference in terms of the symptoms or manifestations on the patients. Again, when we started the COVID-19, it was a kind of debate between the specialists themselves. What are the main symptoms of COVID-19? And they were particularly talking about respiratory symptoms. But as the pandemic continues, it appeared later that the manifestation of COVID-19 could be something else, not only the respiratory symptoms. So people could present with headache. They could present with GI symptoms like nausea or diarrhea, for instance. And from that aspect, we can say there is no remarkable difference with the new variant. So we do expect different manifestations of symptoms. And likewise, applied for the management of the COVID-19, which is going now, is most likely going to be applied for the new variants as well, until we hear or we find something different in that aspect.
Doctor, now this is a very frequently asked question. A lot of people have been asking us that. Can a person who's been cured of the COVID-19 get it again?
Well, again, there is a lot of debate on here, but we like to give or to give the safest option or the safest response here. There are few reports which have been published in different countries globally, and they say that reinfection is actually possible. However, there was no solid study which had concluded on that, saying that someone who gets the infection is going to be reinfected again. It is still a valid hypothesis which actually needs to be verified and studied further. But what is available until now is that yes, it is possible that someone could be reinfected. And with this answer, we actually encourage all people, whether they have been infected or not infected, to continue on having the precautions of the COVID-19. I said that because those reports which have focused on the reinfection, they carry a lot of bias and possibilities why the reinfection happened for for the patient who actually was infected before. We should understand this from the context that some people are actually immunocompromised, or their immunity response to the COVID-19 in the first time might be different from other people. From that aspect, we can say that those people have the possibility of getting the infection again.
And it's always better to be safe than sorry. And Doctor,
absolutely.
What's your take on the efficacy of the new vaccines that are available?
The new vaccine, which was a great achievement for the human population in general, because they have got this vaccine in extremely a short time, but it has passed through all the stages of safety and effectiveness. So it was processed in the first stage of clinical trial, then second stage and third stage. So it was proved that it is a safe vaccine, and we shouldn't hesitate of getting the vaccine because it has been scientifically approved. The effectiveness can reach up to 95%, which is itself effective percentage, and it is actually able, or it would be a great weapon in the fight against the COVID-19. And actually, we carry a lot of hopes in this vaccine to control the pandemic, either here or globally.
And talking about the vaccine, of course, the immunization drive is in full swing in Oman. Could you tell us a little bit about that?
The immunization in Oman is something we need to be proud of because the Ministry of Health, actually one of its priorities is that to make the immunization available to all our people. And indeed, the ministry itself has got achievement, and it has been known globally that Oman is one of the best countries in terms of the immunization process and effectiveness. We had, the COVID-19 is not the only disease which is fought by the vaccine. The immunization which is given for the childhood, for our kids until they reach 2 years, it covers a lot of diseases, not less than 13 diseases at least. And we have a great coverage among those kids. And not only that, but the immunization campaign, which was done at the end of 2017 against the measles, that was another achievement added to the list of achievements to the Ministry of Health, because with that vaccination, we could combat and we could stop the outbreak of measles, which started in Dhofar, and it was actually effectively done.
That's great. Dr. Zaid, what we'll do is we'll take a short commercial break, but stay tuned, we'll be right back.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back. We were just speaking to Dr. Zaid, and Dr. Zaid was telling us about the immunization drive that's going on in Oman, and we have definitely done a commendable job. Dr. Zaid, could you also tell us about how the vaccine drive is going on in South Al-Batina?
Well, the vaccination of COVID-19, we started it on 27th last month. And actually, it is going very smoothly. We had a little concern in the beginning that our people might be hesitant of getting the vaccine. But the reality was actually completely different, that the uptake of the vaccine was excellent. We had utilized all our vaccines of the COVID-19 in South Batina until now. And we do receive the vaccines from the official storage of the vaccine to the South Batina continuously. And we had identified a few medical institutions in South Batina to provide the vaccine to the targeted group. We haven't had any remarkable challenges except the fact that the vaccine itself is limited, not only in Oman, but globally. It is important to say also that having the vaccine available in Oman as one of the first countries globally is itself an achievement. Yes, we have limited quantity, but we do hope that to receive the remaining doses in the coming few weeks. As you know, that the targeted group of the vaccine is actually again limited. We have identified particular groups of people, and the reason behind that is actually the limitation of the vaccine. Otherwise, the vaccine should be given to everyone, with the exception of those which have been identified by the Pfizer company itself, especially the immunocompromised and other people. But otherwise, this vaccine is actually advised for all the rest of people. Until now, I can tell you the numbers as well, that we have finished around 1,500 doses in South Batina. And from the targeted group, we accomplished not less than 56%. And we do hope that the targeted group will be done hopefully during the coming few days.
Wonderful. So the response in the target group was also very good, I'm assuming. Everyone came about as soon as they were contacted.
Absolutely, that is true. Actually, we felt there is a little hesitancy in the beginning, like when you call one of the targeted group and you advise him, okay, you have been selected as a candidate for the vaccine because you have been diagnosed with diabetes and you are over than 65 years as per the definition. You might feel a little hesitancy while you have the conversation with the candidate. But you will be a meter in 1 hour. He will call you back. I'm coming tomorrow for the vaccine. So generally, there has not been any challenge from that aspect.
Wonderful. So they've always been responsive. So apart from reaching out to the targeted groups and their response, were there any other challenges that you met along the way that you'd like to address?
As I said, perhaps the most challenging point here is the limitation of the vaccines. Right. We as concerned people in this department, and we are concerned indeed about the health of our community, we are eager to see the vaccines available for everyone. And so I can say that the limitation itself is a challenge, but hopefully that with the communication throughout the headquarters of the Ministry of Health and with the contact with the COVAX company, we will secure our quota of these vaccines for Oman's population. But in addition to that, you know that the COVID-19 vaccine is completely different than all other vaccines available in Oman. That it required very low degree to store the vaccine. We usually store our vaccines from 2 degrees up to 8 degrees. But the COVID-19 vaccine was different. It requires minus 70 degrees. And again, ensuring that we have the logistic capacity was challenging in the beginning, but thankfully it was prepared very well. And that is the reason that we had identified few centers in the whole Sultanate to be the main storage centers for the COVID-19 vaccine. For instance, South Batina, Bahira Governorate, as well as North Batina Governorate, they all take their vaccines from the store of vaccines available in North Batina region because the freezers which are made for this kind of vaccine are available there, and so we bring the vaccines as per the list of candidates we have in South Batina continuously.
Right. Dr. Zaid, thank you so much for all that information that you shared with us, and it's an absolute pleasure having you with us on this show.
Thank you very much. It is indeed my pleasure, and we wish that we keep providing the important information for all our community in Oman. Thank you for involving me in this interview, and we wish to see you again.
Thank you so much, Dr. Zaid, and thank you for everything that you've done for the community. That was Dr. Zaid Khalifa, the Director of Disease Surveillance and Control in South Al-Batana. He told us about the new variants that were emerging, the risk of transmissibility, and he also told us how the immunization drive is going in Oman and in South Al-Batana. We'll take a short commercial break and we'll be back with more COVID updates.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Hello and welcome back to Fighting COVID on Outline. Like in Oman, the immunization drive has started off in different countries of the world, and we're all hoping that things do get back to normal soon. But let's take a look back and see how different countries have stayed strong during the pandemic. While the impacts of COVID-19 varied between advanced and developing countries, business leaders across the world identified some common features that helped countries remain resilient. The first one has definitely been economic digitization and digital skills. Social distancing has been a key response to the pandemic. Because of this, countries that were set up for remote work have fared better than others. Netherlands, New Zealand, and Finland are a few examples. The second one was safety nets and financial soundness. Countries with established support systems for companies and citizens were in a better position to keep their economies afloat. Denmark and Norway provided much needed support to their households, while Taiwan and the US were able to aid businesses thanks to strong financial systems. Talking about governance and planning, balancing health priorities with economic and fiscal policies was a delicate dance this year. Countries that provided relatively stable political frameworks were Singapore, Luxembourg, Austria, and the United Arab Emirates. The last one was definitely healthcare system and research and development, because a strong healthcare system meant widespread access to health services needed during the pandemic, as well as established public health protocols. Japan, Spain, and Taiwan were good examples of this. Talking about the effect it has had, in other reports by the World Bank, it has been highlighted that the most affected by the pandemic were definitely those that lie below the poverty line. Over the past 12 months, the pandemic has harmed the poor and vulnerable the most, and it is threatening to push millions more into poverty. After decades of steady progress in reducing the number of people living on less than $1.9 a day, COVID-19 will usher in the first reversal in the fight against extreme poverty in a generation. The latest analysis warns that COVID-19 has pushed an additional 88 million people into extreme poverty this year, and that figure is just a baseline. In a worst-case scenario, the figure could be as high as 115 million. The World Bank Group forecasts that the largest share of the new poor will be in South Asia, with sub-Saharan Africa close behind. According to the latest Poverty and Shared Prosperity report, many of the new poor are likely to be engaged in informal services, construction, and manufacturing, the sectors in which economic activity is most affected by lockdowns and other mobility restrictions. Talking about migrants and their ability to send money home, the reports say that remittances, that is the money migrants send to their home countries, are of special concern. Over previous decades, remittances have played an increasingly important role in alleviating poverty and sustaining growth. Just last year, these flows were on par with foreign direct investment and official development assistance. But COVID-19 has spurred a dramatic reversal, with our latest forecast finding that remittances will decline by 14% by the end of 2021, a slightly improved outlook compared with the earliest estimates during the pandemic. But these are still historic declines. All regions can expect a drop, with Europe and Central Asia seeing the steepest fall. Associated with these declines, the number of international migrants is likely to fall in 2020 for the first time in modern history, as new migration has slowed and return migration has increased. These drops are cutting off a lifeline for many poor families in developing countries. Migrants' remittances are crucial to households around the world, and as they decline, experts fear that poverty will rise, food insecurity will worsen, and households risk losing the means to afford services like healthcare. The pandemic slowdown has deeply impacted businesses and jobs also. Around the world, companies, especially micro, small and medium enterprises in the developing world, are under intense strain, with more than half either in arrears or likely to fall into arrears shortly. To understand the pressure that COVID-19 is having on firms' performances, as well as the adjustments they are having to make, the World Bank and partners have been conducting rapid COVID-19 business pulse surveys in partnership with client governments. These do offer a glimmer of good news. Responses collected between May and August 2020 showed that many of these firms were retaining staff, hoping to keep them on board as they ride out the downturn. More than a third of companies have increased the use of digital technology to adapt to the crisis. The same data warned, however, that the firm's sales have dropped by half amid the crisis, forcing companies to reduce hours and wages, and most businesses, especially micro and small firms in low-income countries, are struggling to access public support. In short, reduced family incomes, whether due to job loss, a stop in remittance payments, or a multitude of other COVID-19 related factors, will continue to put human capital at risk. With less money, families will be forced to make trade-offs and sacrifices that could harm health and learning outcomes for a generation. On a different note, apart from the UK variant, the other variant that has been making headlines of late is the South African variant. So what is the South African variant of the COVID-19? Well, as viruses make copies of themselves to spread, they mutate, making tiny genetic changes along the way. There have already been many variants of the coronavirus that causes COVID-19 since the outbreak of the pandemic, but a small number of them are giving scientists and public health authorities cause for concern. One of these is the so-called South African variant, also known as the 501Y.V2 strain. It emerged in August in South Africa's Eastern Cape region before spreading to other provinces as infections accelerated. Now, why are people worried about it? One cause for concern is that this new variant could be more contagious, much like the so-called UK variant. Another concern is that the mutations could affect the way the virus responds to the existing vaccines that are being administered to control the pandemic. The South African variant includes changes to the coronavirus spike protein, which is what the virus uses to get into human cells. This is also what COVID-19 vaccines are designed around. So now the question everyone is asking is the South African variant more deadly? Fortunately, there is no evidence to date that it causes more serious illness. Dr. Kilindi Gaskin, director of the National Virus Reference Laboratory, said preliminary findings suggest the variant is associated with a heightened viral load and may have increased transmissibility, but that there is no evidence to date that this variant is associated with higher severity of infection. Now, another question that everyone is asking is, what do Pfizer and BioNTech have to say? German company BioNTech said on Friday that a preliminary study shows that its vaccine does work against a key mutation in coronavirus variant uncovered in Britain and South Africa, which experts have said is more contagious than normal coronavirus strain. Tests have shown that antibodies from people who have received the Pfizer-BioNTech COVID-19 vaccine effectively neutralize SARS-CoV-2 with a key mutation that is also found in two highly transmissible strains. The B.1.1.7 coronavirus, which emerged in Southeast Britain last year, has shown to be significantly more contagious, between 40 to 70% than the normal variants of the virus. Pfizer-BioNTech's coronavirus vaccine, which is being rolled out around the world, relies on the body's production of a particular part of the virus, the spike protein, which the immune system then learns to kill. Because the mutation in the British variant and the South African variant directly affects the virus spike protein, there had been fears that it would render the vaccine ineffective against the mutant versions. But BioNTech said this research carried out by Pfizer and the University of Texas Medical Branch indicates that the key N501Y mutation, which is found in the emerging UK and South African variants, does not create resistance to the Pfizer-BioNTech vaccine-induced immune responses. Authors of the study itself said, however, the findings were limited as the mutated variant tested does not include the full set of spike mutations found in the rapidly spreading strains in the UK or South Africa. The research has yet to be peer-reviewed and confirmed, but experts expressed cautious optimism at the findings. On that note, we'll take a short commercial break and we'll be back with more.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to Fighting COVID on Outline. Now, there have been a lot of terminologies floating around recently, for example, the RT-PCR test. Now, with regard to what the CT value is and what it indicates, here is what you need to know. In RT-PCR test, which is the gold standard for diagnosing COVID-19, a positive reaction is detected by accumulation of fluorescent signal. CT value indicates the number of cycles needed in the RT-PCR test to amplify viral RNA so it can reach a detectable level. A lower CT value of 29 or below is a sign of high viral load. A CT value of 30 to 37 indicates moderate amounts of viral load. A CT value of 38 to 40 indicates a minimal viral load. Another thing that we've heard is the emergency use authorization by FDA. So what is it and when is it used? In certain types of emergencies, the FDA can issue an emergency use authorization or EUA to provide more timely access to critical medical products that may help during the emergency when there are no adequate, approved and available alternative options. The EUA process is different than the FDA approval, clearance or licensing because the EUA standard may permit authorization based on significantly less data than would be required for approval, clearance or licensing by the FDA. This enables the FDA to authorize the emergency use of medical products that meet the criteria within weeks rather than months to years. EUAs are in effect until the emergency declaration ends but can be revised or revoked as evaluation goes on about the needs during the emergency and new data on the product's safety and effectiveness, or as products meet the criteria to become approved, cleared or licensed by the FDA. On one side, we have the vaccines and on the other side, we have the drugs. FDA has approved certain drugs for the treatment of COVID-19. Baricitinib is a Janus kinase inhibitor which blocks the activity of one or more of a specific family of enzymes interfering with the pathway that leads to inflammation. Baricitinib is a prescription oral tablet medication that is FDA approved for the treatment of moderately to severely active rheumatoid arthritis. The FDA authorized the emergency use of baricitinib in combination with remdesivir for the treatment of certain hospitalized patients with suspected or laboratory-confirmed COVID-19. Remdesivir is another FDA-approved intravenous antiviral drug for use in adult and pediatric patients 12 years of age and older and weighing at least 40 kilograms for the treatment of COVID-19 requiring hospitalization. Remdesivir also remains authorized for emergency use for the treatment of suspected or laboratory-confirmed COVID-19 in hospitalized pediatric patients weighing 3.5 kg to less than 40 kg or hospitalized pediatric patients less than 12 years of age weighing at least 3.5 kg. That was all about the new strain, the FDA-approved drugs, and also how different economies are coping with the challenges the pandemic has thrown towards them. And of course, we also had Dr. Zaid Khalifa from the Disease Surveillance and Control Department telling us about how the situation is in South Al Batana. We'll be back with more updates like this next week. For now, over to Maitha.
Thank you, Antara. And once again, happy accession day to His Majesty Sultan Haitham bin Tariq. Tune in again tomorrow for more midday updates, and thank you for watching TTV.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.